nursing has been pivotal for me. It's completely changed my life. As I continue to go through my career, it all got kind of old. And that bug hit me of really wanting to do something that was more impactful and making a difference in people's lives. And so I applied and I got the opportunity to work burn ICU. It's still one of the most powerful moments for me. I had not seen anything on this level before. The patient was lying on this like a metal table. This lady had both of her legs were severely burned. I'm seeing bone. I'm seeing muscle.
Oh, goodness.
It was significant. So I was like, all right, ma'am, you found your purpose.
For any nurse who is looking to kind of step out of a toxic work environment, what are some steps that they can take?
Be open that if there are true opportunities to improve for yourself, do those things. None of us are perfect. All of us have things that we can do better. But in terms of knowing your worth, knowing who you are, knowing what's in your heart, own that and don't ever let anybody make you doubt that about yourself. That would be my biggest piece of advice for anyone who finds themselves in those toxic. And you know in your heart when you're in it. I could give 5 or 6 to list out 10 signs, but it's more of it is a gut feeling than any very specific action that's being taken.
Welcome to the Nurse on Purpose podcast, where we challenge media stereotypes about nursing and spotlight the incredible and diverse roles nurses play in healthcare. I'm your host, Nello. Every week, I'll be joined by a nurse who is reshaping the narrative. From frontline care to leadership, education, innovation, and beyond. Our aim is to show the world that nursing is so much more than what we see on TV. Together, we'll explore how we can collaborate with media and other stakeholders to create authentic and inspiring portrayals of nurses. Let's begin the conversation and ignite change, one episode at a time.
Hi, everyone, and welcome back to the Nurse on Purpose podcast, where we spotlight nurses who are not just doing the work, but owning it. Today, I'm thrilled to welcome a guest who is redefining what it means to lead with purpose in healthcare, Dr. Dayna Scott-Vidal. Dr. Dayna, also known as the Recovery Nurse Executive, is a Southern-born healthcare powerhouse with a heart for nurses and a mind for systems change. She's got over a decade of executive leadership under her belt and currently serves as Senior Quality Officer at Wilson Medical Center, where she's helping shape safer, smarter hospitals. But here's what makes her stand out. She's not just about climbing the ladder, she's about building a whole new staircase for nurses. Dayna's passionate about helping nurses, whether they're brand new or pivoting mid-career, to take full ownership of their practice. Her upcoming book dives into just that, how nurses can align their specialty with their natural strengths and finally ditch the idea that their career belongs to a hospital. She's also a fierce advocate for nurse autonomy, a champion for leadership that actually leads, and an author who is bringing real talk into healthcare spaces that desperately need it. Welcome to the podcast, Dr. Dayna.
Hi. Thank you so much for having me. I'm so excited to be here. And I got a lot to live up to after that introduction. Listen, I got some work to do.
No, because that is all you. That is all you right there. I didn't make anything up. I didn't add anything in there. I didn't embellish. Probably didn't even list the full scope of what you do. But really glad to have you. Say hello to my NOP fam.
Hi, everyone. I'm so excited to be here on Nurse on Purpose podcast. I have been looking forward to this for so long, and I'm excited to be here and be able to share something and maybe even learn something along the way as you and I talk and share with your wonderful fan base you have here.
Yes, my fan base is wonderful. Small, but we're growing. So thank you for being here. So I introduced you as the Recovering Nurse Executive. Can you tell us where that name came from?
Yes, it was really about my most recent leadership experience and little things that I have learned and experienced along the way. While nursing has been pivotal pivotal for me. It completely changed my life and how I have approached not only professionally, how I approach things, but also personally, emotionally,
Yeah.
my well-being. It has been so transformative for me and a very positive experience. But along the
Yeah.
way, there have been lessons that I've learned and things that I've experienced in my own growth and development of learning hard lessons sometimes, where that name came from.
Yeah.
There is surprisingly more toxicity within the nursing profession that it would probably surprise some outsiders. I won't say it would surprise nurses because we live it every day, that we are caretakers and we get into this to help people. But sometimes
Yeah.
in the midst of that, it seems like some nurses, not all, kind of maybe lose their way a little bit, maybe take their eye off the ball of what the overall objective is, whether we are helping patients, whether we are helping the community, and whether we are
Yeah.
helping other nurses. Sometimes I think it gets a little lost in the shuffle in our efforts to do the right thing. And just like anyone else, we're not perfect. We get that label of being superheroes, but we're not perfect. We are human beings and we make
Yeah.
mistakes and we have lessons that
Yeah.
we all have to learn. And so my last role, I experienced a level of, I guess I could only call it toxicity, that really make me take a pause and take some time to really reevaluate myself, my own career, and honestly had me questioning some things that I had done and that I had experienced, listening to others who I valued their opinion at one point in time, and then really realizing once I stepped away from it that they were wrong. They were wrong, and that perceptions can be very toxic and misunderstood even within the nursing profession, just like it can be with any profession.
Okay, so we're gonna get into it because I want to also simplify. It feels like we're still mystical.
Uh-huh.
I want to break it down further and demystify it. And you and I have talked, but I think that my listeners will gain so much from hearing kind of the hard truths
Mm-hmm.
about certain
Mm-hmm.
spaces, whether it is based on your color, based on your gender, whatever it is. Let's start back to the top where where you started your journey in business, marketing, and advertising. And so nursing is a second career for you. Can you walk us through that journey of what even led you to pursue nursing?
Absolutely. I was actually went to Florida A&M University. I was in their School of Business and Industry. Go Rattlers. Um, and I had the opportunity to do an internship program. Everyone in that business program does a wonderful internship experience. My internship was with Pfizer Pharmaceutical. And as a part of that lesson, we were sales reps. We had the company card, the credit card. It was back few years ago when being a pharmaceutical rep was everything. You had these big budgets. I mean, it was a great experience in professional development. But as a part of that role, you needed to learn medications that Pfizer was selling. I was in the labs division and learned about the skin because we were about to sell azithromycin, which was new on the market, and Norvasc, which was new at that time and taking the place of cardizem CD for lowering blood pressure. So I needed to learn very specifically everything about the cardiovascular system and the integumentary system. And this is being a business person, had no idea. I had biology in high school and that was it. So got fully immersed in that because
And probably forgot
oh,
all
I
of
had
it
forgotten all.
anyway.
It checked the box. It was something I needed to graduate from high school. That was it.
Right.
So you take this person who's been in business school for, at this point in time, almost the full 4 years, because this was the last thing I had to do to graduate. And
Yeah.
it was 2 semesters long. We got in there. We had to learn all of these things because we're selling medications and sitting down and speaking with providers. We need to know what we're talking
Right.
about. I fell in love with the whole learning how the body worked. I loved learning about the medications and the effect that it had on the body. So from an anatomy and physiology perspective, I was all in. I
Nice.
started having long, lengthy conversations outside of it was more in the clinical space and about patient care with some of my providers. And so I went and had the opportunity to go sit in on surgeries. I had a doctor invite me to go see a hysterectomy, a C-section. These were a lot of OBGYN providers that I was
Ah, you got
calling.
your
Oh,
clinical
I was
already.
all in. I was all gowned up and everything. I was like, what am I doing? But they asked me if I wanted to come. So yeah, I'm an adventurous type person. So I was all in. And in the midst of all of that, I caught the bug, but I was 22 years old, right? And I'm thinking, oh my gosh, I'm too old to start over. You learn, you
Hindsight.
think back on stuff like that and you're like, oh my gosh, if I could have given
What was I
myself some advice
thinking?
back then, but I don't know. I
Mm,
did not know what I know now
of
about
course.
pivoting and career pivots and changes. But yeah, I was like, I'm almost done with school. This is the last thing I got to do. There's no way I'm starting over and going into healthcare. Go be a doctor, go be
Right.
a nurse. I don't know. So fast
Yeah.
forward 10 years later, and again, that bug kind of hit me that I wanted to do something more meaningful. I was doing a lot of corporate advertising. It was a lot of fun. I was doing post game concerts with the Atlanta Hawks, the Atlanta Braves. It was a dream for someone in their 20s living in Atlanta when the music industry was popping off in Atlanta, and there was so much to be involved in, and I was in all of it. I did
Mhm.
everything. I was traveling with the basketball team sometimes. It was a lot of fun. I learned a lot, but there was still somewhat of an emptiness. And as I continued to go through my career, it all got kind of old. And that bug hit me of really wanting to do something that was more impactful and making a difference in people's lives. And so I was visiting my grandmother right around that time. She had gotten really, really sick. She was somewhat bedridden. She was still healthy, but had to have a below the knee amputation. And so she was a little bit more confined to the bed. One
Yeah.
day she got really sick. The caretakers weren't sure what was going on with her. We didn't either. In our family, we had no one clinical. And
Yeah.
so took her to the hospital, and I was helping her get out of her wheelchair, literally, and she had a little blanket around her and it fell. And the back of her gown was open, and I saw a pressure injury for the first time ever. And I could put up the size of a plum that I could have fit
Mhm.
into this space that was
Wow.
open on her lower back. Would not have even thought someone could walk around like that and not be in excruciating pain, not understanding
Mhm.
fully how that would have impacted her and how she wasn't feeling anything. She was past those nerve endings that would have really felt and
Right.
caused her real pain like that. So I was shocked. And to this day, it's one of the reasons why I'm so passionate about pressure injury prevention specifically. But we got her into the hospital, and I was visiting her. She got very septic. She didn't know who we were. She didn't know who I was.
Yeah.
She had all those toxins running through her body, and she was pretending like she knew who I was, but I could tell by the look on her face she wasn't recognizing me, and that was
Mm.
heartbreaking and devastating. But while I was sitting there, her nurse walks in the room, and it was change of shift time, and it was her night nurse was coming in, and she was just coming, hey Miss Erin, how you doing? I'm just coming in to say hi, and my grandmother's face just lit up. Like
Mm.
she had a smile on her face.
Oh
Her face was
man.
just bright and clear. And she said, oh my goodness, are you taking care of me tonight? And she said, yes, I am. And she's just like, oh, I'm so glad. And I saw all that relief and that the confusion that was there, and just her joy of having that particular nurse, and the feeling that it gave me as well, of knowing that
Mm.
someone was there who was obviously taking great care of my grandmother. And in that space, it was an easy decision for me, and I was like, well, that's it, I'm going to be a nurse. And so because at that time I was like, I don't know, nurse, PA, do I want to be a provider, a doctor? I did not know what I wanted to do, but it was as clear as a bell from that nurse walking in that day that was my calling.
Mm.
And so that's how I ended up going, like, immediately in 2 months. I was at Atlanta Metropolitan College redoing my prereqs and getting ready to start applying to nursing schools.
Wow. That gave me shivers. Like I don't get goosebumps, but I just felt like chills. That was a beautiful story. I love it when people just have these inspiring tales of how they got into the nursing profession, because when you have that strong reason, it keeps you going and it keeps you grounded even through life's ups and downs and the chaos and all of it.
Right.
So thanks a lot for sharing that. Now, you had shared with me earlier that your first nursing role was with the burn unit. Can you tell me what that experience was like, and just how it shaped your perspective as a
Oh,
nurse?
absolutely. I landed there haphazardly. I didn't choose to go there. I didn't, when you're in nursing school, you don't, I mean, you learn about sunburns at the
Really?
most. You don't
Yeah.
really learn very much about the very complicated, severe burn
Hmm.
injuries because it's so
Hmm.
specialized. But I
Wow.
knew that I wanted to go into the nurse externship program. And for any nursing students who are listening, I highly recommend to try and get into a
Highly.
hospital, be a nurse extern, be a PCT, something, because
Yep.
it leapfrogs you in your experience. You get to do a little bit more application outside of a simulated space. And then you're also kind of connected to that hospital. So hopefully it's the hospital in the area you would want to work in. All right. Public service announcement over. But yes, I
Such a good one, though. Valuable.
yeah, I was sitting in class one day and one of my colleagues came in. She was late and she was just like, "Oh my gosh, I overslept." And I was like, "Oh man, are you working?" And she said, "Yes, I'm a nurse extern over at Grady Hospital." And so
Mm.
I heard it. She was just talking about it. And I was just like, "Ooh, I want to go there." And so I applied. It took a little while and I actually ended up just waiting and waiting, and I got the opportunity to work there. I All I could really say at that time was that I wanted to be in critical care. Could I hopefully get a space in critical care? I didn't designate or say. I didn't even know not to say no, not the burn ICU. But I'm
Mm.
glad that I didn't know enough because I would have stood in my own way and blocked my own blessings, right?
Oh, that's so good.
So when we got to orientation. So first day of orientation, walk in, there's just a little roll to sign in. Everybody's signing in. I see 3B next to my name. I have no idea what that is because all the rest of them had like mother baby. They were saying what
Yeah.
they were.
Yeah.
Surgical ICU, like you could see where
Mhm.
they were going. And I was like,
Yeah.
so what's on 3B? And I think she did
What's
it on
3D?
purpose. So someone sitting next to me actually worked at Grady, and so they knew. They were like, "Oh my God, girl, that's the burn unit." And look, I didn't even know enough to know about the burn unit. I just read her expression. I was just like, "What? The burn unit?" I didn't even know enough to be shocked, but her being shocked on my behalf made
Right.
me like,
Right.
"Oh, I
Wait,
guess this is
you.
how I need to react." What? I literally went to the nurse extern manager and said, "Is there any way can you switch me? And do I have to?" She's like, "Who got in your head?" And I was just like, "I
Mhm.
just think maybe that's not the right." And she was just like, "Listen, just give it 3 months, and then we'll go from
Mhm.
there." So that very same day, they told us to go down to your units. You'll meet your leader and just
Mhm.
introduce
Yeah.
yourself. So I go head down,
Mhm.
introduce myself to the unit director, and she's like, "Oh, okay, yes, nice to meet you. This is the charge nurse." And I'm still thinking like she's the charge nurse is getting ready to take me like on a scavenger hunt or a tour of the unit, something introductory, right? She tells me where to put my backpack down. She
Mhm.
takes me to hydrotherapy. I'm still thinking I'm about to tour, right? She's like, "We're going to go to hydrotherapy." And I was like, "Okay, great." I got my backpack and I put my backpack down and she gives me the yellow gown. I gown up. So there I'm like, okay, this is not a tour. She gives me a
Getting ready to go.
washcloth and
Yeah.
she tells me, "You're going to help me debride this patient." And literally a washcloth, and I'm using the CHG soap on the wall. And it's still one of the most powerful moments for me
Mm.
as a person who wasn't a nurse yet. I was still a nurse extern. I was a senior about to graduate, but I had not seen anything on this level before. The patient was lying on this like a metal table, and there was someone standing there. They have these big hoses that descend from
Mhm.
the ceiling, and they use
Mhm.
those for the water as a shower. One of those metal gurneys that has the little gutters along the sides for the water to
Oh,
drain out. And
right.
I'm sitting there just like shell shocked. This lady had both of her legs were severely burned. I'm
Mm.
seeing bone. I'm seeing muscle.
Oh, goodness gracious.
It was significant. and I'm debriding, and the charge nurse is just like, yeah, just wash wherever you see the damaged skin. And I'm like, it's everywhere. Like, what do you mean,
Wow.
just so I'm doing it.
Every-
I'm doing it because I'm like, I'm going to get through this. I'm going to push through. Um,
You just had to put your poker
Oh
face
my
on
goodness,
and
and
go
just
for it.
push on through it. And what was so transformative, and why I say that I could have blocked my own blessing and gotten in the way, is because this person, she had been in a car accident. And so both of her legs were crushed severely. And she kept looking at these pictures on the wall. I couldn't make it out. I was all caught up in my own drama. I was not really paying all that much attention. And it
Mhm.
turns out that she was looking at pictures of her newborns. They were taped onto the wall because when she got into this accident, she was pregnant with twins. And when they were setting her legs, she had gotten caught in that car. They had problems extricating her from the car. It was a bad car crash and it had caught on fire. By the time they got her out, she had smoke inhalation and all of that. So they took her to the OR. She had her surgery. And while she's in surgery, she went into labor. And so they had to do emergency C-section. And I think back on that and I say, I got out of that corporate marketing and advertising because I wanted to find more purpose, because I wanted to do something that to make a difference. And I had time to reflect right after we got through with what was a 2 to 3 hour dressing change. And I said, well, kiddo, this is what you asked for. You wanted to do something impactful. And what other situation could there have been? This lady needed all of these needs. She needed burn care, trauma care, and NICU, for these babies. And it was a profound moment I was on the unit the day that she was discharged and pushing her outside in that wheelchair. She's got a baby in both arms. I was like, all right, ma'am, you found your purpose. Like, and you tried to fight it. Look at that. You tried to not
Oh
be
my
doing this.
goodness.
So
We're gonna have to shut down this podcast because for real, all your stories
okay.
are just killing
I know,
me.
and I feel like
Wow.
storytelling, and I know we're going to get into this a little bit later, but I feel like telling stories is so impactful. It's just, standing and talking, it's all good and it's great information, but there's nothing like sharing a story. And I think it's good if nurses are able to maintain dignity, privacy for the patients. But we learn from these stories and we're able to help someone
Yeah.
else. We're also able to look at our own lives, right? I don't take, I, don't- I it, that whole moment, I had two small kids at that time. And seeing some of these things that people have experienced and what they go through brings a whole different perspective. So it's not even learning in that clinical space from a professional perspective, but also how to adapt in our own lives and not take things for granted. And so that really has been one of the most valuable things that nursing has brought for me. And we can only do that by sharing stories with each other.
So you eventually transitioned into quality and safety. Was that intentional or did it happen organically? I feel like when we first of all, when we had our conversation, you were just like, I fell into that. I just hopped. And you know what? We may think that we fell into something, but God has a way of like ordering your
For
steps.
sure.
And yeah, and just like you described, you would have blocked your own blessing. But let's talk about quality and safety because that's something that you're so passionate about. Tell us how you got into that
Okay.
role.
And it's funny you use the words fell about falling into something because I fell, and that is how I ended up in this quality space.
My sheep
Okay,
is
another
falling.
story. I'm sorry, it's another story, but it is the story of how it happened. So I
Love
was
it.
taking care of a patient in the clinic, in the burn clinic one day, and there was something on the floor. There was a spill. I slipped and fell, and my knee twisted under me in a very special way. Um, and I had to take time away from the bedside. I had to have surgery and everything. And I begged my unit leader, please don't make me go sit on another unit. Is there anything that I can do? And she was like, no, it's perfect timing. I had also just happened to decide that I wanted to be a super user for our electronic documentation. So when we
Mhm.
were converting from paper chart to electronic documentation, I was still relatively new and I wanted to, if I was going to, if since I don't know the clinical space, like
Mhm.
that expert level. I'm big on
Yeah.
Dr. Patricia Benner, right? And so that novice to expert pathway.
Mhm.
I
Mhm.
wanted to at least
Mhm.
be the expert in something. So I'm gonna be the
Yeah.
expert in documentation while I'm still getting my clinical acumen skills, under my feet. And
Yeah.
so because I had those two experiences and the sales experience from before, and I was really
Mhm.
good in the computer, she
Mhm.
allowed me to be in this position that was for a registrar, which is you need a registrar on burns and stroke and trauma.
Yeah.
And so we weren't a verified or certified burn center yet. The goal was to get there. She had this FTE sitting there, but that no one wanted to do, and she had it there for a
Mhm.
while. She said, "Well, I'll temporarily put you in that, and you can do that
Mhm.
work." Needless to say, I never came out of that. I loved it. That was a quality position. So it was identifying
Mhm.
opportunities for improvement, putting every single patient that comes through the burn center,
Yeah.
putting them into the registry, identifying opportunities for improvement, how we could do better with our care. And I fell in love with it. There were so many opportunities along the way that I had seen where we could do things better on the unit. Tried to advocate for
Yeah.
those things. We made changes, but to now be in a
Yeah.
formal role that, hey, this is
Right.
your responsibility to do, it was the change. I always thought that I was going to go back to the bedside, but that is how I kind of got away from the bedside and ended up in those quality positions, which just kind of
Mhm.
led to staying in that role and education in that space. Yeah.
Yeah. In keeping with that, you were drawn to, process improvement, patient safety, and performance. Now, it's important that I want to mention that you don't have to be in a formal role, just like you said. There are so many things that as a nurse you see every day,
Oh,
and
absolutely.
you can make changes, you can make suggestions, and you can use your voice, right? You don't have to be in that formal role, but being in that formal role really gave you that leverage, right? Because
Absolutely.
yeah,
And
yeah.
it requires a
Um,
little bit of vulnerability, right? It requires saying, I almost made a mistake, or I made a mistake, or I've seen where this is a potential. We're not perfect. I took care of a patient once, and I was you have different areas where you have burns, and so you treat them differently. So a patient who's gotten a graft, those wounds stay bandaged up for 3 days post-op.
yeah. Mhm.
Burns that aren't operated on, you change them every day. I
Yeah.
accidentally unwrapped the wrong arm. I unwrapped the arm that
Mhm.
was newly grafted. That was my very
Mhm.
first, hey, we got to do something to make this better.
Yeah.
I don't know if I got the report wrong, heard it wrong, if it was given wrong. There's just human error because we are humans. There's the potential for that.
Mm.
And so I
Mm.
don't know if I was told the wrong arm that needed the dressing or which one
Mhm.
had the surgery, but we needed to do something different and better. And so we put a visual cue in the room that showed which arm was which so that we could
Yeah.
reduce the chances of something happening like that. But it required me being vulnerable and not trying to be perfect and admitting, hey, y'all, I
Yeah.
unwrapped the wrong arm. That patient ended up having to go back to surgery, had to have
Mhm.
that arm regrafted because when I unwrapped
Mhm.
it, the grafted skin was on the bandage. And
Yeah.
so that's what I think with safety and quality, it really requires that vulnerability to admit you're not necessarily maybe patient harm can happen, not because
Mm.
you are not skilled or because you need to get educated more. Many times
Mhm.
it's just human error. You can have the most
Right.
experienced nurse make an error because they're
Yeah.
tired, hungry, the lighting's bad. Someone comes and
Yeah.
talks to them, and so I counted something wrong or I pulled the wrong medication. These things
Yeah.
happen. And so what I very much enjoy doing is looking at our processes and our systems to try to error proof things as much as possible and reduce the chances of those errors happening and keeping patients safe.
That's wonderful. I wanted to ask, since you're no longer at the bedside, or at that point, since you were no longer at the bedside, how did you figure out what needed to be improved at the bedside? Were you collecting like
Mm-hmm.
metrics? Like what was the process for bridging that gap? Because now it seems like you're removed, you're now in this executive position. When you made that mistake, you were at the
Mm-hmm.
bedside, so you knew what needed to be fixed. How do you bridge that gap now?
Oh, that's such a good question. The only way that you can do it, you have to engage the frontline staff. You can't sit in a boardroom or sit in your office and think you're going to make these decisions.
Yeah.
I'm probably speaking on things that it might not even be the process anymore right now because things
Mm-hmm.
change. Thankfully, we're always improving and we're always trying to do better for patients. Processes change. Recall I was just telling someone the other day about I had left my burn unit, and it was years and years later, and I was going in. It was a difficult time on the unit, and I was going in to help do dressing changes. When I tell you, I can do a dressing change with my eyes closed, but I didn't know where to find the medications. It looked
Yeah.
different, just taking the tops off of
Okay.
the pain medications. I was like, I couldn't even open the vial for the pain. I was like, this looks totally different.
So
Where's my
different.
little vial? And I pop the cap, and I keep it, it's very different. But we change things. So the
Yeah.
only way that you're going to be able to do that is by engaging the frontline staff, asking
Yeah.
questions, observing, watching, and seeing what's actually happening. We can't think that we're going to know all the things because we did it at one point in time. Like that's old.
Yeah.
That's old.
Yeah.
And so to
Yeah.
stay abreast of everything, and then you can't know it all because you can't be there all the time. And so making sure that the frontline staff are engaged, making sure to ask questions, and not just nursing. I mean, it's got to be everyone who's touching that patient to be able to understand all the different points of contact and where anything could possibly go wrong. So really looking at the full process, and you're only going to know that
Yeah.
by engaging the frontline staff.
For sure. I want to go back again to the very first question I asked you about being the recovery nurse executive, right? And having to deal with some toxicity. I said we were going to unpack that a little bit. And of course, I only want you to go as deeply as you want to go. But for any nurse who may be listening and is looking to kind of step out of a toxic work environment, what are some steps that they can take? And also, what are some steps that leaders can take to create that healthier workplace for nurses? And if you just kind of tie it back to your own experience.
Sure. I would say the first thing is, while I think a lot of nurses take responsibility for themselves, we have our own license, we practice to our own, we protect that, right? And so many of us are willing to accept conditions that may not be it may not be honestly. I'll give you the perfect example. So I think that as you progress through on to leadership, I was really okay with everything, but the higher up sometimes you go on that ladder, right? That leadership ladder, the stakes are higher. The stakes are higher for your responsibility, the team that you're responsible for. And depending on what the setting is, sometimes there's a lot of competition with amongst the leaders. And you're trying to save face, you're trying to do your piece over here, but because we're also interrelated. And so when you continue to hear from a leader, and this was some of the experience that I had, when you hear from a leader that it's about the team, it's about protecting the team. I'm sitting there thinking it's about my team, my direct reports, the people who are looking for me to help support them, guide them, and protect them. And be fair and honest and objective in doing that. But what I realized that the team that was being referred to was not my team. It was the executive team. Yes. And when I realized that, I was like, oh, okay. So that explains some of the behavior that I have seen of leaders throwing their own staff under the bus to protect themselves
Protect the top.
at the
That's what
top.
it sounds
At the
like.
top.
Yeah.
One of the most heartbreaking situations that I saw was there was a nurse manager. She had some opportunities for improvement, but instead of her leader dealing with them, he literally wrote a letter, mailed it from a whole different zip code and everything so it couldn't be tracked back to him, and pretended to be a patient complaining about that manager.
Oh
When I
my
heard
goodness.
that, I mean, I've seen some things, but I had never seen that level of deception. I had never seen that level of cowardice is really what it was. Because you could, if this particular
That wouldn't take
manager
them
had
long
an
to prove.
opportunity to improve, it's your job to point those things out, put them on a plan, help support them. And then if you determine that it's will versus skill, that this is someone who's not willing to do better or who just doesn't want to, then you make a decision and you say, okay, we need to part ways. I'm going to free you up for another opportunity, so to speak. But to do something like that, to lack that courage or that skill of being able to say, how are you going to manage it? And instead you decide to try to really wreck someone's reputation. I found that type of behavior very toxic, but it was being supported. I will say that.
Mm.
And so I had to ask myself some questions. And so I decided one day that I was going to speak truth to power. And here's one thing I will say to anyone who finds himself in a toxic situation and you do make the decision that I don't think I can do this, or let me point this out. Let me make sure that people know what's going on.
Mm.
And you decide that you're going to speak truth to power. Be prepared that power is not always going to be receptive of the truth. A lot of times power knows the truth already, but you
Mm.
bringing it to light forces them into a place where they're going to have to make a decision. Am I going to stick with this toxic culture and continue to permit it? Because what you permit, you promote.
You promote, yeah.
Or am I going to continue to try to cover and pretend that's not what it is, and I'm going to destroy the messenger? And that was what my situation was. I spoke truth to power. I told
Mm.
power what I thought of. I was very honest. I had allowed one situation. Let me just chronologically say what exactly happened. A year before I really ran into these issues, I had already been chastised. And I actually just wrote an article about this that I haven't posted yet, but I will be posting on my LinkedIn to read it in a little bit more detail. But
Mm.
was standing up all sorts of new projects, completely had revamped the department and was doing a lot. My team was performing very well. I was getting praised and getting kudos by my leader in public spaces. Had just had my eval, and because we had been doing so much standing up, and I had great, exceeds expectations all across my evaluation. Went away for a week, finally took a vacation that I had not had in about 2 years. Took this vacation, came back, and when I tell you, she didn't even speak to me. I'm saying tight face, and I'm like, what is going on? I'm just sitting there trying to figure out what happened when I left. I don't,
Mm.
and I'm literally going to her, checking, hey, is everything okay? I'm a very transparent person. I do go head on at things. So I'm not just going to sit back and be like, oh, I hope she doesn't say anything. I went to her and is everything okay? Yeah, that's fine. And I'm like, okay. I mean, I can't do anything with that, if we're not going to communicate and talk. And so time went on, and maybe a couple of weeks later, and I had a one-to-one. Getting the one-to-one, and all this whole time, I'm still getting the silent treatment. I have like when I tell you, no idea what's happening. Have a meeting, have my one-to-one, and all this, I'm going through everything. We're talking through everything. I'm going through my little PowerPoint, updating on all the things. And, you know, I'm not sure what's going on with you, but I'm just not really satisfied with what you've been doing. You started a project about 8 months ago. It was a new meeting, and it just isn't going. And I'm like, 8 months? In 8 months, we're just now going to talk about this? And why
Mhm.
wasn't this brought up months ago? And so I don't know. I still to this day don't know. Is it because I finally took a vacation? Even though we've, in public meetings and spaces, it's all, y'all, you can't pour from an empty cup. Take care of yourselves. Protect your well-being. And then, so I'm not
Mhm.
saying it was that. I was left to wonder because I could not understand where it was coming from. And I was
Or maybe
literally,
it
and
was
I said,
just
well,
used as an excuse.
right. And so I'm asking for examples. Well,
Mhm.
I got my pen and paper out, and I'm like, well, could you give me some examples specifically what you're referring to when you say you're not really satisfied with how I'm running my team? No, I'm not going to sit here and go through a list, but I will tell you that in the meeting the other day, you had your arms folded.
I'm so sick of
My
that.
arms were crossed. Okay, but I was engaged in the meeting. I was. T- I, I'm. I don't even remember. But you know what? And here's the mistake that I made is I accepted that. I accepted everything that she said. I even accepted the folded arms, which as I'm sitting there, I was like, when did I have my arms folded? Okay, but if she said my
Mm-hmm.
arms were folded, and I guess my folded arms said something totally different than all the work that I've been doing,
You were
but
doing.
I've just got these folded
Mm.
arms. Um, I'm gonna and I owned it and I said, well, I will do better. I want you to have confidence and that you have me in this role. I took it 100% and I worked my tail off even more. We were already doing amazing things. And I made sure that my arms were never folded in meetings.
You look closed off, Dr.
I
Dayna.
was
That's what
closing
it
myself off. Although even though I was leaning in, like I'm not, you know,
is. Yeah,
but
yeah. Like your face wasn't
I, I,
folded.
oh my goodness. So um, I said, okay, well, I will definitely be more aware of my body language, and I will, I want you to have confidence in me. So I spent about a year, and over that year, and I'm not going to go into all the things, but there were so many little things along the way,
Mm.
and I finally had a last straw moment. And but here's where I went wrong. I didn't have a plan. I didn't have a plan for the decision, and I
Mm.
made a very specific decision to say that I was going to speak truth to power, and I'm not going to get gaslighted anymore. I'm done with all of this. I thought at that time that if I just called it out, that might help, but it did not. And
Mm.
yeah, two
Wow.
days later, I was packing boxes and I was on my way out of that building. Yes, I was very respectful and professional in my feedback, but it was not able to be received. And I think it just was something that could not be received by this person, an
Mm.
inability to receive that feedback. And
Mm.
I I spent the next, I already had a trip planned to go to Italy. And so I spent that time in Italy with my husband. It was about a 2-week vacation with a cruise. It was perfect timing, to be honest with you.
Mm-hmm.
Also, my son had just gotten drafted to play professional football. So I got to spend the next few months really living that
Wow.
and enjoying it. Because I tell you,
Congrats.
a job at that level, it takes everything. You're meeting almost all day and you're trying to be present with your team. And then you're actually doing your own work at night. Most of the
Mm.
time you're up. It still felt like 12-hour shifts to me, really,
Yeah.
to be in that
Yeah.
role. And I loved it. I loved it. I loved the work. I loved my team. We were doing amazing things. But I made a decision to speak truth to power. And the one, I don't regret speaking truth to power. Let me be very clear. I don't regret doing
Mm-hmm.
it. It was the only thing that me, as how I'm built and made, was the only thing that I
Mm-hmm.
could do.
Yeah.
Or it was going to be a less controlled situation where
Yeah.
I might not be able to control my words, but I was able to control my
Mm-hmm.
words. There's not a single thing that I
Mm-hmm.
would change in how I said it. I would have just only
Yeah.
changed having my plan afterwards. But again,
Mm-hmm.
none of this is my plan, right? It's all
Yeah.
God's plan. So maybe
Yeah.
that's exactly how it needed to happen because the where
Yeah.
I am right now is so different. It's so much
Yeah.
better, so much more fulfilling. I would never have
Mm.
met someone like you or been on this podcast because, to be honest, if I posted something on LinkedIn, it was, why didn't you tell me about that? Why didn't you do? Well, because it's my
Mhm.
LinkedIn and it's my career, and so my that experience totally changed my perspective moving forward. And so my
Mm.
advice would be to anyone who is in that situation: please recognize the toxicity for what it is. Don't
Mm.
allow yourself to be gaslighted even for a minute. If there are, be open that if there are true opportunities to improve for yourself, do those
Mm.
things. None of us are
Mm.
perfect. All of us
Mm.
have things that we can do better. But in terms of knowing your worth, knowing who
Mm.
you are, knowing what's in your heart, own that and
Mm.
don't ever let anybody doubt that, make you doubt that about yourself. That would be my
Absolutely.
biggest piece of advice for anyone who finds themselves in those toxic. And you know in your heart when you're in it. I could give five or
Yeah.
six to list out 10 signs, but it's more of it is a gut feeling than any
Yeah.
very specific action that's being taken.
Yeah. I think there's so much wisdom in the way you handled it because I felt my heart like getting hot and I was like I would have been like one
Oh,
two
listen.
but just the way you took responsibility even for the things that you were not sure what she was talking about. And now at that level you're not only in in the room with nurse executives, you're with all kinds of hospital
Hmm.
leadership, correct?
Hmm.
Okay, so it wasn't necessarily like a nurse exec or medical kind of executive.
Right. Now this is executive at the very top.
At the very
Hmm.
top. Okay. Yeah. But I do applaud the way that you handled yourself. I feel like coming into a relationship with you, I noticed that you really do carry yourself with a lot of grace, self-control, and wisdom. Like you strike me as somebody who has been there and seen a lot of life, not age-wise, but just have seen enough to know this is how I handle myself in certain situations. And there's a time to speak and a time to be silent. So I admire that about you. And just hearing your story now for the first time proves what, confirms that thought that I had about you. I'm speaking of, owning yourself and taking ownership of your own profession. Let's talk about your book. Your book is really geared toward the nurse who needs to find their fit, right?
Yes.
And find that area of nursing that really suits their personality. So tell me about your book, the inspiration behind writing it, and just what message you want people to take from it.
Thank you for asking me about that. The book is titled Find Your Fit, A Nurse's Guide to Choosing the Right Specialty. And right means right for you, and that's why it's about finding your own fit.
Absolutely.
I know how lucky I got landing in the burn unit, but I have seen over the years so many nurses floating around trying to find that space for themselves because maybe they listened to someone else or maybe they thought that they were stuck in
Yeah.
one place. And I find that particularly, I had an experience in an executive role leading the residency program and the nurse externship program. There was
Hmm.
a nursing student. She came in as a nurse extern. She was wonderful. I kind of bonded with her and was checking in with her as she was continuing to push through school. And I was like, she's going to be fabulous. She's going to be great. She had a passion for wanting to go to the ED. And so
Mm.
she went to the ED. Of course, she got the job like it was just because it was just supposed to happen. She
Hmm.
interviewed. They were very impressed with her. She got the job. She was very excited. She went all in. I'm thinking, okay, that's the beginning of a beautiful story. And so about 3, 4 months in, I saw her sitting in one of the education classrooms. Lights were out, and she's just sitting in there quietly. She's waiting for one of the classes coming up. And I popped my head
Hmm.
outside and I said hey to her. And she came over to me and she gave me a big hug. But I was shocked at how she looked. She had dropped a good 15 pounds.
Oh.
All the energy and that light and that spirit that I saw in her was gone. Like it was gone. And I asked her, I just pulled back from her a little bit and I was like, you doing okay? What's going on with you? And she just burst into tears. And I was like, okay, let's go to my office. Let's go talk. And she was not having a good experience. No one was bullying her, harassing her. People were supportive, but it just wasn't what she thought it was going to be. And she was having some really tough moments. And what she got into nursing for, she said she wasn't finding it. And she was really worried that she had spent all this money, all this time, that she didn't want to disappoint her family. There was so much emotion going on with her. And so just worked with her. And this was my very first, you've seen it before, but this was the first person that I knew from the early beginnings of her journey into the nursing profession to this point that I was like, this is a person who should be a nurse. I need to figure out how to help her get realigned with her purpose again. And what I really found was
Mm.
that did not, she wasn't getting fulfilled in the ED. The ED is a wonderful place, but there's a fit for everybody in all of these different
Yeah.
specialties. She wanted to
Yeah.
make more connections with patients. She felt like seeing patients coming in, she wasn't able to get to know them. She wasn't able to build a
Mhm.
relationship. It was just, you know,
Yeah.
well, you know what they say in the ED is treat them and street them, or they're getting ready to
Yeah.
go to the unit, or they're going to get admitted
Yeah.
somewhere. It's not, I'm not saying that there's not any room for that, but that she was seeing way too
Yeah.
much death. I mean, you're talking about a level 1 trauma center. So she's seeing a lot of
Wow.
that and not feeling like she was making a difference. That was how she felt.
Mhm.
And so,
Mhm.
and the crux of it was she's seeing some of her colleagues, peers that she graduated and went to school with, thriving. They're showing up, they're bebopping, they're drinking their monster drinks, unfortunately. You know, all they needed was energy,
Unfortunately.
but they're getting energized by being
Yeah.
in that
Yeah.
space
I
where
mean,
she felt
wow.
drained every single day. And so I
Wow.
really, I took it very personally because being over that entire residency program from an executive strategic position, I was like, we're failing some of
Mhm.
these people. And it's no wonder that you've got 40% of new grads, 30 to 40% of new grads leaving after 2 years of being a nurse. That's a lot. And
Yeah.
if you think about nurses who are spending that money that they are in private
Yeah.
for-profit nursing programs because they're trying to fulfill this dream. I mean, that's devastating. You got student loans,
Yeah.
whatever it is that you did, whatever sacrifice you did to make it to
Yeah.
be to that point. And now in 3 or 4
Yeah.
months, you're like, I might be seeing all this evaporate because this isn't what I thought it was going to be. So some of the
Yeah.
techniques and things that I did with her, other things that I've learned over the years of trying to help new nurses and nurses who are experienced nurses who are trying to pivot
Yeah.
and applying those things. That's really what the book is about. And in that book, you know, I talk about storytelling. In that book, every
Mhm.
chapter starts
Mhm.
with a true story from a nurse. I interviewed
Wow.
a number of nurses, getting their stories, talking about, I mean, some of these were stories from when they were new grads. Some of them were after 20 years of being a nurse and maybe how they pivoted
Yeah.
or how they found that right fit and why they felt like it was the right fit for them. And so my goal is to, in a very data driven way, because there are some tools in there that the reader can use to figure out on their own, take away, you
Mhm.
know, what your colleagues are doing, what
Mhm.
other nurses are doing. What, you know, everything isn't just about money. So the money will
Mhm.
come if you've got the passion. Right. So it's
Yeah.
not just,
Yeah.
oh, what's the most highest paid thing that I can do? And then you
Right.
try to go
Right.
do it. You're not happy. Guess what? You're not going to make that much money because you're not even going to want to get up every day to go and do that thing. So it's
Right.
about trying to find what gives you that joy and fulfillment. The money will come. And so I am
Right.
really focused on trying to help those folks find their fit. And that's what the book is about.
That's perfect. And so I'm going to ask, just for the benefit of my listeners, and because we have you on the podcast, how exactly can a nurse narrow down their choice? Like if they have maybe a choice between, they're torn between multiple specialties, or they're already in the wrong unit, or just trying to figure out, like, how do I know what is right for me?
Mm-hmm.
What are some key things that they need to be looking out for, whether that's internally, like personality wise? What are some things that you would say look out for this?
So if you have the opportunity to, so for a new grad, for instance, a nursing student, I'll give that example first. During
Mhm.
clinical rotations, really observe what happens on that unit. Not
Yeah.
just, oh, I had to write a care plan and then I'm getting through. The technical skills are going to come, but this is the
Yeah.
best opportunity you have to literally be physically in a space to see what it's
Mhm.
like. Observe at the end of that clinical rotation. Did that experience make me feel energized? How did I feel when I left at
Mm.
the end of that day?
Mm.
And a lot of times we don't
Mm.
necessarily take that little quick inventory of our feelings and ourselves, especially in nursing school, because
Mm.
we've got the task of list of things that we are supposed to be there for.
Yeah.
And I think it's underestimated of trying to figure out, going ahead and start thinking about where your fit is because you're so focused on gaining these clinical skills, and that's important.
Or let me just
Uh-huh.
cut you off for a second. Or some people are already told, they've already been pre-told you have to go into this once you graduate first and then go into something else later. So
Absolutely.
sorry.
Absolutely. Oh, no, that's,
Mhm.
and I'll say this both ways with that one. I don't think anyone should feel like they have to be locked in because they're being told that they have to go anywhere. But let's say, for instance, you find yourself in a position where that ICU, the space in the ICU, you cannot find anything. You are not,
Mhm.
because everyone doesn't always let new grads into the ICU. That's just a reality.
Right.
So if you can't, go ahead and start planning that pivot, right? And
Mhm.
so if you have that be your backup plan, if I can't get
Yeah.
choice A, because I would say that that is the biggest thing. I think a lot. I saw and I heard from a nursing student, not student. She's not a new grad anymore either. She still doesn't have a
Mhm.
job. It's been a year since graduation, a year since passing the NCLEX, because she's insistent on being in the ICU. I think that there does need to be a balance between, I'm going to get that dream thing that I want. Nothing's going to stop you from doing that. But in the meantime, you got bills to pay. There's a reality to
Mhm.
some of this.
Mhm.
And then it
Mhm.
starts to become the question of, how adaptable are you? How flexible are you? Because the same adaptability that you will have to be able to pivot is the same adaptability that's necessary on a daily basis, taking patients as a nurse. So
Mhm.
I say, definitely don't confine yourself, put yourself in a box. Go for it, right? Go for
Mhm.
it. You want to be a labor delivery nurse and someone's saying, no, you need to
Mhm.
go to med surg first. Don't accept that. Keep
Mhm.
trying. But if it's more of a
Mhm.
availability of the job, you can still be
Mhm.
looking while you do the other thing,
While you do
right?
the other
Get
thing.
those bills
Right.
paid. You're building
Yeah.
and gaining some level of experience,
That's right.
but
That's
continue
right.
looking for that dream job. Continue looking for the
Right.
thing that it is that you want to
Yeah.
do. So I would say,
Yeah.
don't ever stop, but also don't let these big gaps happen on your resume, and
That's
don't show
right.
an inability to be flexible and to be
Right.
adaptable, because you just never know. And again, I'll go back to that burn center story for me, that if I had had my way, I would not have been in the burn ICU. But being in the burn ICU put me into a specialty that gave me opportunities that I people look at my resume to this day and they see burn ICU. Wow,
Mhm.
it is
Mhm.
very different. And I've carved out my own uniqueness and space within that. That can even be done in med surg, right? Because
Yeah.
that, and I'm only using med surg because that is most often what I hear from new grads, like, oh, they're making
Mhm.
us all start in med surg. And I hear experienced nurses say all the time, everybody should start in med surg. I do not believe that. I didn't.
Mhm.
Um,
Mhm.
and so sitting here as a product of someone who did not just start off in
Mhm.
med surg, I don't think that that's a requirement or a necessity. But I
Mhm.
do want
Yeah.
to encourage the power of the pivot, the power of
Mhm.
get somewhere, start getting that experience. And in the
Mhm.
meantime, go looking. And it gives you
Yeah.
opportunity to narrow it down even more.
And because employers will look favorably at
They
that
will.
versus somebody who has nothing at all.
Absolutely. And I'm speaking from that person. I was in that, I mean, I was over the residency program. I was over, we touched every single nurse that got hired into the hospital, came through,
Mhm.
comes through that professional development department, whether it's
Yeah.
orientation, whether it's helping to assess a new nurse or an experienced nurse, and in
Right.
every single area. So whether it was the ED or whether it was stroke or whether it was in critical care, I've
Yeah.
seen every single one of those departments and have a good understanding of when they're sitting down what they're looking for. The fact that if you
That's
come in and you say, I wanted critical care, I always wanted critical care, there was not another opportunity for me, but it meant so much for me to be a nurse, and I want to gain that skills and increase my acumen
yeah.
from a clinical perspective.
Yeah.
I
Yeah.
did that, but I'm still pursuing
Yeah.
my dream. So it shows two things. One, your commitment to your dream, and two,
Yeah.
but your ability to adapt and pivot. And you've got
Flexible.
to have that,
Yes.
because that's
That's
every
important.
day in nursing. You're pivoting. You come in at the beginning of your shift and you have a whole plan. And by lunch,
Mhm.
that plan might be
But
out the window.
rip it up, okay?
Tear it up, baby, because guess what? You got a new admission, or your patient,
Yeah.
starting to
Mhm.
desat, and now they're, you got you got to call a rapid response. what happened to me? I was just going to
Yeah.
be ambulating the patient. The plan, the care, the daily goals was to get your pain controlled and out the window. So being able
Right.
to flex that muscle and exercise
Yeah.
that adaptability muscle is
Yeah.
key. It's really
And it builds
important.
you, it grows you. Yeah.
Absolutely.
But
Absolutely.
I really love what you said also at the beginning, that see how you feel during clinicals, and don't think that clinicals is too early to start feeling out what might be your fit, right? Because
Absolutely.
I remember when I was in that labor and delivery, Dr. Dayna, let me tell you how I felt. I felt queasy, I felt lightheaded, and I threw up twice. And my professor, my clinical professor would be every day, they'll be like, does Chinella look a little green to you? And so all my classmates would make fun of me every time we finished a rotation. They'll be like, does Chanel look a little purple to you? Because my
Yes.
face would
Yes.
be flush. I would just, I'm out of here.
Yes.
But I came alive on the P's unit.
Absolutely. I'm big on that one. And that was, and
Mhm.
I think only because it was nursing was a second career for me. I was
Yeah,
very much in tune to doing that. That is
yeah,
one thing that I
yeah.
did from the very beginning. I just knew I was going to be labor and delivery. I just knew it. And my
Mm.
first clinical rotation, I was like, that's not for me. Like immediately, I was kind of like you. I was like, that's not for me.
No
No,
thanks.
thank you.
I like the
I love the
babies, but
babies.
not just after, post delivery.
Absolutely, absolutely. Then I pivoted and
Oh,
switched,
yeah.
and I thought, okay, I want to go to ICU because I thought I wanted to do CRNA. And then I spent
Oh,
some time in the OR, and I was just like, not for me.
not for me.
That wasn't
Yep.
for me
So
either. I was
that's
so
good.
it being, and if you have it, and sometimes I think you get so, especially the more determined and the more ambitious you are that this is what I want to do, you can
Hmm.
overlook the why. Keep going back to the why. Why do I want to do that? And if it's because, and you go
Mm,
back to the why exists in a lot of places. The why doesn't
mm,
exist in just one specialty. And so
yeah, yeah.
juggling that and trying to figure out why is it that I want to do this thing. Now, if you say I want to one day
Absolutely.
be a midwife, you're gonna have to go
Yeah,
through you're definitely that's your why. You want to bring life into the world. But
yeah.
really capture that and understand the why. Taking that inventory at the end of a clinical, I think is really key.
Mhm.
And I definitely
Yeah.
think asking around and separating, this is key, separating the culture from the work, because just because someone works in oncology and they're miserable and they don't like it, don't necessarily
Mm,
subscribe that to oncology, right?
mm.
That could be the
So true.
hospital, that could be that
So
leader, that
true.
exact same unit with a different leader
That's
might be
so
a
true.
totally different experience. So don't
Yeah.
necessarily attach. You got to separate that as much as you can and ask those questions that help you get down to the root of it and find out,
Yeah.
is it the leader? Is it, is
Yeah.
there just some culture here? Because
Yeah.
hospitals have personalities. They have their
Yes.
own personalities and their own culture. And
Yes.
one
They
experience
do.
in one
They
hospital could
do.
look totally different in another hospital.
That's so true. Totally true. I've experienced that and I get it. But this has been such an insightful conversation. Oh my goodness, I could talk to you for hours. And just listening to you talk, has really lit up my day today. Thank you for sharing, for being so transparent and vulnerable in all of your experiences. We are going to pivot now to our kind of last portion of, you're a storyteller, so I'm excited for this actually. The last portion of the podcast where we talk media. So if you've seen any shows, tell us your thoughts about how nurses are portrayed. What are your thoughts about that?
I have historically been. I am big. I'm a huge TV fan, huge movie
Mm,
fan. I
right.
love it. So I go back and I think about some of the shows that I have seen and experienced. There's only been one, in my opinion, that's come close to capturing nurse, and that's more recently is The Pit. It's a show on.
Everyone's
Oh, I
talking about
love
the
it.
pit.
And not only
Oh,
the
wow.
reality of what happens, and I mean, of course, they're going to condense and concentrate some of that drama because it is a TV show, but it's very close to capturing the reality and the nurse's
Hmm.
role and how pivotal it is. I think it has,
Absolutely.
one of the things that I see the running theme is that nurses are a helpmate for the doctors. In so
Hmm.
many shows, you see doctors doing the things that, oh no, and actually a nurse does those things.
Hmm.
You got doctors administering medications and sitting
Yeah.
at the bedside and holding the
Holding
patient's hands.
hands
And I'm not saying no doctors do that,
that they don't do
but
right,
they
of
just, it's
course.
not even in the space, the time frame of how their work is structured, that they're really
Right.
able to do that the way that it is portrayed in the media. And,
Hmm.
and then all we do is just do what a provider tells us to do. And that's another thing that
Yeah.
has really, uh, I don't know, I guess it just really does kind of rub you the wrong way. It's one of the reasons why I love going into quality, because I feel like if they portrayed us a lot more, the amount of equipment that nurses have to know, the skills that we have to develop,
Mm.
the technology in the work. It's one of the reasons why I wish there was another award. I love the Daisy
Yeah.
Award. I do
Yeah.
wish that there was another award that really
Daisy Award.
showcases the amount of our knowledge, our skill set,
Yeah.
the technology that we have to know, the amount of
Yeah. For
education that we
sure.
have to have, especially once you
Yeah.
reach a certain level, the certifications, the documentation, all of that. I
Yeah.
just think that it's
Yeah.
it is less emphasized than the caring part, which is wonderful,
Caring power. Yes. Yes.
wonderful. But I
Yes.
think that is
Yeah.
what kind of takes over in that media presence for
Yeah.
us is,
For
we
sure.
hold the hands and we,
Yeah.
yeah.
But we want to be scientists as
Hmm.
well as, compassionate as well. We want both of those things to be aligned, not
Absolutely.
just,
I'm so glad that you
yeah, not
talk
just
about this,
caring
because
nurse.
absolutely. I bought a book, and it's one of the reasons that motivated me also to write the book that I wrote is read a book that during COVID, and it was all about nurses. And it was
Mhm.
written by a nurse, and I was so disappointed because it really only focused on, yeah, doctors do this, but the nurses, we're there in that patient's time of need, and we care, and we're 360 degrees. It's like, we do that. I think it's really clear. I think everybody knows that about us.
Yes,
But I
yes,
want to push
yes.
this other piece, and maybe that's how we get away from just being included in the universal room charge, right?
That's right.
How we
Right,
how we
right,
own our
right.
profession. I
Yeah.
know some stories of nurses. I won't say any names, but they are not. They get chastised for going and being on LinkedIn and owning their practice. And this is my
Hmm.
license. Starting
Hmm.
businesses is not really encouraged. If you go off and
Yeah.
even getting a PRN job, they're like, "Oh yeah,
Yeah.
she's got a PRN job over here." It's like the hospital doesn't own us. And
Mm.
a provider can get on TV and do all kinds of things, and
Hmm.
they can own businesses and also provide
Right.
care to a hospital, and they're not seen
Yeah.
as being, betraying the hospital or betraying their
It's that
commitment to
traditional
practice.
subservience. That's what it
That's
is,
exactly what
right?
it is.
First, it's the
It's the
gender.
gender.
And then it's the fact that traditionally nurses have been in the background. And when you've been in the background for so long and you're trying to break away from that, there will be some pushback and resistance
Absolutely.
from the ones whose backs that you've been,
Hmm.
you know,
And I think
behind,
that's what
right?
makes it harder for, to get the proper staffing that you need in the
Yeah,
hospitals, to advocate for
right.
keeping nurses safe. All of that
Yeah,
goes into us not owning the pivotal role that we play. And I think
yeah,
that if we continue to push for ourselves, and don't
yeah.
allow ourselves to be owned by the hospital or
Mm.
owned by by a practice, then
Mm.
we can it puts us in a better position to advocate for the things that we need, in whatever setting we're caring for patients.
I'm so glad you brought up this idea of like owning yourself, and not letting the hospital own you, because there are these like subtle ways that hospitals thinking that they own the nurse, that mindset shows up a lot in hospital culture,
Hmm.
especially when it relates to nurses, staff nurses, maybe not the ones in leadership, because, Alice told her story about when she was on Dr. Oz, and the hospital at the time was like, you can't do that. Like, there's a lot of more qualified doctors who should be doing that, or even nursing executives who should be doing that. But why not? Why will your own profession not push you forward into representing yourself well? It's that sense and that mindset of we own you, but no, you don't own me. I own myself and I own
Absolutely.
my own license and I own my own
Mm-hmm.
practice. If something were to happen, if a malpractice event were to happen, you'll quickly realize how much the hospital doesn't own you,
Right.
because they will be like, oh, all right, she went to school on her own, she has her own license, we're not responsible for that.
Absolutely.
But when it's the other way around, now all of a sudden they want to own a part of that.
Mm-hmm.
So grateful that you brought that up. All right, so let's play our game. Oh my goodness, I've learned so much from you today, honestly. um, so I'm going to shake my jar here real quick. Pick a category and you have to tell us one of your wonderful stories yet again.
All
Okay,
right.
so here we go. Oh, this is different. So your category is thriller, like a crime, true crime.
Okay.
Thriller.
Okay. So this, I would come up with a story and say that this story is a murder mystery, right? We're thinking Agatha Christie type murder
Okay.
mystery. And there's a the matriarch of the family. Okay, I'm getting ready to
Mm.
really get into something. The
Oh my
matriarch of
word,
the
I love this.
family was found lying beside her bed with a head injury. She is no longer with us. She did pass away as a result of this head
Mm,
injury. And we can't figure out
mm,
why, what happened to her, because also beside her is a bottle of pills that has spilled. And no one can figure it out. There's some police. They call the police, okay? And the police are there and they're
mm,
trying to
mm,
figure out this mystery, right? They can't put two and two together. Does it have something to do with the pills? Did she fall and hit her head? Did someone hit her with
mm,
something? Because she's got
mm,
money and there's like five people who were there for the weekend, right? We're all got,
mm.
look, I'm making this up as I go. There was a big family gathering. It was a wedding going on and everyone
I
came to
love
the
it.
house and everyone has been
Mm-hmm.
talking. There's like five people who are all suspects because each one of them has some sort of a motive. One might want her, one's got a failing business, another one is just, like he's just a gigolo and
Mm-hmm.
he just wants a bunch of
Mm-hmm.
money. He plays tennis on the weekends.
Mm-hmm.
That's all he wants to do is just play tennis. So we've got all of these different parties and people that have a motive, and we can't figure out exactly what happened. Right? Why?
Mm-hmm.
We also got the professional golfer who was a gambler, and now he's lost all his money. I don't know where I'm getting these
Oh.
characters from, but they.
All right. This tells me that you really
I
are a
am. I
TV
love it.
buff.
I love it. Okay, so no one can figure this out. It's a real mystery of how it happened. But there is someone in the household who was the secretary to the matriarch.
Mm-hmm.
We all kind of know she didn't have anything to do with it because she really was dedicated and committed. She loved this woman. And she's also already in the will, which she knew. So she didn't have any real reason to try to get
Murder.
rid of her. And so she looks very closely at the crime scene because whatever no one really realizes, no one knows, is that before she became her personal secretary, she was a nurse. And that is why she was hired by the matriarch, because she also helps take care of her. She's her personal secretary and she's her nurse, her caretaker. So what she
Mm-hmm.
knew by bringing in her nursing experience was that it had to have been a not she did not fall and hit her head. She could tell because of her nursing experience how her feet were not like tangled up. We know as nurses how patients can get tangled up in their sheets, and that's usually how they fall. She also knew that she knew from her own experience of taking care of the patient of look, I'm calling her a patient, from taking care of the matriarch, that she also has severe pain at night, and she rarely moves because if she moves, she has severe back pain. And so she
Mm-hmm.
rarely moves at night. So it was not getting up out of the bed, because when she gets up out of the bed, she calls the caretaker to come and help her get out of the bed. This is old school. She's got the little bell that rings.
Yeah.
She
Yeah.
rings a little bell and lets her know when she needs some help. She didn't get called. And so she knows, okay, she has the back pain. She would not get out that bed because she really could not get up out of the bed by herself without help. She knew that as her nurse slash caretaker, personal secretary. She also knew that she did not fall on her head for that reason. She also recognized that the pills that were strewn over on the side, that the patient was not taking those. So it could not have been accidental, some sort of accidental or intentional overdose, because
Right.
those pills upset her stomach and she had refused to take them, right? So nurse slash caretaker knows that as well. So she's the one who deduced this was not anything, it was not an accident, that it was not any sort of self-inflicted, it was not suicide, that she had been murdered. I'm going to say that in my British accent. She had been murdered.
Murdered. Oh, such a good whodunit.
So it turned
I
out she
love
was able to figure out, because she could also tell by the golfer. It could not have been the golfer, because she noticed from her assessment, her perceptive assessment capabilities, that the golfer had a shoulder injury. She saw him wincing earlier, because nurses, we pay attention to all the things, right? We're assessing people all the time. But she was like, it couldn't be the golfer because he's got a shoulder injury, so I don't think it's him. And so she really has narrowed it down to the gigolo tennis player, because she saw a little bit of, again, being perceptive. She noticed that he refused to play tennis the next day. Why? Because his tennis racket was broken. She found it and it had blood on it. And she figured she solved the crime. As a nurse, she used her nursing assessment skills.
Oh my God, I love this. Listen, okay. First off, let me just tell you that we're gonna need to collaborate and actually make this show happen because
Listen, let's do it. Look, we'll get with Shonda Rhimes and it'll be the
yo,
next
for
Netflix
real.
series
For
that she
real.
does.
That's a wonderful, you know what? This has been wonderful talking to you and just kicking it, laughing with you. Grateful to have you on here. Can you just tell people where they can find you to connect?
Absolutely. I'm on LinkedIn, and you can find me easily. You can Dayna Scott-Vidal. I'm also known as Dr. Day, the recovering nurse executive. I
That's
also
right.
have an Instagram handle with Dr. Day, and it will be Dr.Day. You can find me that way on Instagram, also on TikTok, and I also have a YouTube channel, all with the same name.
Yes, wonderful. And that will all be on in the show notes. So thank you so much, Dayna, for being here. Thanks for being a voice for nurses, who are ready to take the wheel and chart their own course. And you guys, if you've ever felt boxed in by the system, if you've ever felt unclear about your next move, or like you had to ask for permission to grow, let this episode be your permission slip. Thank you for reminding us that your nursing practice belongs to you, not your badge, not your job title, definitely not your employer. So whether you're starting out or starting over, you have the right and the responsibility to align your work with your purpose. So as we wrap up this episode, please remember that you are not just part of the system, you are a force in it. So as always, go boldly and go purposefully. We'll catch you in the next one. Take care. Bye-bye.
Bye-bye. Thank you.
Thanks for hanging with me till the end. I hope you gained some valuable insight into the world of nursing. If today's episode inspired you, please like, subscribe, and share with someone who needs to hear about the amazing work nurses are doing. Let's keep breaking stereotypes and reshaping the narrative together. I'll see you next time.